Good afternoon and welcome. We'll get started in just a second as folks are coming in Zoom. Okay, I'm going to go ahead and get started. Well, good afternoon. My name is Tania Valmore. I am the Associate Director for Strategic Initiatives at the Milken Institute School of Public Health at George Washington University. And I'm also the manager of the Diversity, Equity, and Inclusion Task Force at Milken. It's been 5 weeks since Russia launched its military of Ukraine. And according to the United Nations and the United Refugee Agency, the escalating conflict has caused displacement of 6.5 million people and has led to the deaths of over 800 Ukrainian civilians. We are joined today by Dr. Lynn Goldman, Dean of the Milken Institute School of Public Health, and Dr. Ronald Waldman, Professor Emeritus of Global Health at the Milken Institute School of Public Health and President of the Doctors of the World USA. We will be taking questions throughout this webinar, and there will be a period at the end for moderated Q&A. Feel free to drop your questions in the chat, and we look forward to a very lively discussion. And we'll turn it over to Dean Goldman, and I'll go ahead and share my screen.
Thank you so much, Tania, not only for the introduction, but also for your support in making it possible for us to hold this. And welcome to all of those who are in our audience. Happy Public Health Week to you. I wish it were a happier week, but it's a very obviously fraught time for all of us in public health with what we've all been witnessing, most of us very much second and third hand in terms of the assault on the country of Ukraine. The way we have divided this up, I'm going to be talking a little bit about some of the broader and longer term environmental and mental health consequences of this assault, and then Dr. Waldman is going to talk about the immediate humanitarian issues and as well as medical and health issues that are involved. So we go to the next slide. My perspective on these issues is informed not by work that I've done during conflicts, but rather work that I've done for the National Academies well after conflicts, where we have reviewed what has happened to people. And in particular, what the United States has been concerned about is our veterans and what happens to our veterans after they participate in conflicts. And there are a number of specific agents in the environment that are important in the context of warfare. Some of them are chemical agents. Chemical agents obviously are very directly involved with chemical warfare itself, and we often have seen them deployed directly, but we've also seen them deployed as an adjunct to warfare, such as happened in the Vietnam War when the herbicide 2,4-D was used in Vietnam to destroy forests to make it easier to find people. But chemical contamination occurs in other ways. There can be either deliberate or accidental, but often it is deliberate destruction of various kinds of manufacturing and industrial facilities in our built environment, where perhaps that is a way of exacting economic damage or stopping supply chains in the context of warfare. But also there can be chemical contamination that is created as a result of deliberate bombing certain kinds of facilities. We saw this in some of our wars, like Operation Desert Storm that the United States waged, where there was deliberate bombing by our enemies at that time of petrochemical facilities. But that creates a tremendous amount of air pollution as well as environmental contamination and the kind of smoke that burns forever. Incineration of waste is another very important source of contamination in warfare, where things are done very quickly. And sometimes the consideration is only about short-term considerations around survival of soldiers and not particularly the niceties about doing things right. And people are exposed in that way. Next slide. We also have biological agents that can be important. There can be deployment of bioweapons themselves. We have seen that, or that there's bombing of bioweapon facilities in order to destroy the ability of a combatant to use them. But also there can be unintentional spread of biological hazards through the destruction of infrastructure, even destruction of, for example, waste disposal facilities, which can cause spread of biological agents through untreated sewage and so forth. Next slide. And radiological hazards, which can be, again, like with biological and chemical hazards, be involved with actual weaponry that is using nuclear materials, radionuclides, in the deployment of the weapons, but also attacks. For example, attacks on the areas around the Chernobyl plant, attacks on nuclear power facilities, which in the context of Ukraine, we've been told have not resulted in radiological releases, but that often in retrospect have resulted in such releases. And I think that when we see those kinds of attacks, we do need to be concerned about the potential for radiological exposures. Next slide. So we learned a lot from things like the World Trade Center. Consider these two high-rise buildings that were attacked by aircraft and burned, and the numbers of people in the New York region who were exposed to toxic materials from this, the smoke itself, the silicates, various chemicals, many of which are carcinogens that were released from this, and many people who were disabled, who were first responders or who lived in the immediate vicinity because of prolonged exposure to this. Next slide. We also learned, and we're still grappling with this in the United States, the burn pits that our military have used to destroy all kinds of things just thrown into these pits. It is what it sounds like. Pits that all kinds of material, chemicals, broken down vehicles, equipment, anything thrown into them and burned. And there's now a program that's being implemented to actually compensate veterans who have prolonged illnesses from having been exposed to this kind of thing during war. Next slide. Oil well fires, which I mentioned already, which, as you can see, this was, again, Operation Desert Storm, enormous amounts of air pollution, long-term health consequences in people who are with our military and were exposed to this. Next slide. We've also seen a lot of evidence for PTSD, post-traumatic stress disorder, veterans of all kinds of combat. And even people who are trained and serve in the military, even just witnessing traumatic events that occur in the context of war causes post-traumatic stress that can also occur after a natural disaster, a terrorist act, a rape, and it's been long understood, and it has had different names. In World War I, they called it shell shock. World War II, they called it combat fatigue. But PTSD is a very real disorder that has very serious consequences to health. Next slide. So we know people with PTSD have intense and disturbing thoughts and feelings, flashbacks or nightmares. They can feel sadness, fear, or anger, a mix of emotions, detachment or estrangement from other people, which is very dangerous. And they may tend to avoid situations or people that remind them of the trauma, but also they can have strong negative reactions. Next slide. And it's not easy to diagnose because the exposure can be indirect. It can have to do with having learned about the violent episode. It can also, among veterans, it's been documented with people who actually were not under fire or did not fire on anybody, but had the experience of seeing dead bodies, seeing dead animals. Even veterans who were in the military at risk for deployment to a combat area who were not deployed, many of them have been found to have PTSD. And so that you don't have to have direct engagement as a combatant. Next slide. So what are we seeing in the country of Ukraine? Indiscriminate bombings of buildings. You'll hear about the direct impacts of a lot of this from Dr. Waldman, but this is like World Trade Centers all over the country, with the buildings burning down and the kind of materials that are present in the smoke from that. Next slide. Intentional bombings of petrochemical facilities. This is like Operation Desert Storm, bombing the oil wells. That smoke has the same toxic compounds, the same potential to harm health. And there are civilians who are within reach of this smoke. Next slide. The nuclear power plant was bombed. We're told no radiation escaped. I have a wait and see attitude about that because I think in the immediate aftermath, there are a lot of reasons that sometimes we're not told or that it isn't recognized that there has been escape of radionuclides. Next slide. The actual engagement of many people in Ukraine in the military and doing civilian defense, so being put through the stress of being a combatant, many of them with absolutely no preparation or psychological screening or any other safeguards around that we would normally have with people who serve in combat. Next slide. The exposures to civilians. This is something we don't look at very much in the United States. I told you, most of the work I've done involves veterans. Veterans are impacted by these exposures. What about small children? They have developing bodies, developing lungs. They're breathing these materials. They are witnessing things that no human being should ever witness, but especially a child. And that is something that is territory that I think we don't understand very well, but we know that the long-term psychological consequences are likely to be very serious. Next slide. So, in summary, do we really know what's going to happen to the people in Ukraine and the people in the surrounding area as a result of all this? No, we don't. But I will say one thing that we do know, and that is that this conflict is extremely injurious to the health of the people in Ukraine, but it's also injuring all of our health. I am personally traumatized by what I'm seeing. And I think all of us in public health want to do everything we can to support the people in Ukraine, our colleagues, and all of those in the surrounding area who are doing what they can to help the refugees. And with that, I'm going to turn things over to Dr. Waldman. Hi, Ron. It's great to see you here.
Thank you, Dean Goldman. That was really an excellent introduction. You touched on a lot of very important points, and particularly your closing remarks were very relevant and very pithy, and I'll repeat them at the end of mine. I'm going to try to give a fairly brief overview of what's going on in order to leave time for and comments at the end. Tanya, thanks for putting up the slides. Let me apologize in advance. I'm speaking to you from the south of outdoors because I've been having some problems with my Wi-Fi indoors. So I think you probably hear the sounds of birds in the background, maybe the sound of my dog barking. I won't yell at her right now because I'm otherwise occupied, but I hope it's not too distracting. Let's begin. Tanya, could I have the first slide, please? I wanted to bring to everyone's attention that the study of the consequences of war on the health of civilians is, of course, not new. And I just wanted to make reference to 3 items. One, this book, and Victor Seidel, War and Public Health, which is a little bit dated now. And my understanding is that Barry Levy is publishing a new book on the subject this summer. It's still fairly relevant despite its age, and I hope the same can be said for myself and many of my colleagues. But let me cite also an article in The Lancet from the year 1993, which I reread while preparing for this talk. It's so relevant to what's happening in Ukraine. It's by my colleagues, Mike Toole, Steve Galseth, and they wrote these observations while they were doing a needs assessment during the Balkan War. I think they did this specifically from Bosnia, but I just reread it, and it's remarkably relevant to the current situation. And finally, almost presciently, Hugo Slim, one of the leading, if not on humanitarian assistance and human rights, has written the book called Solferino 2021, Solferino being the battle that inspired the founding of the International Committee of the Red Cross, of the principles of the ICRC. It's called Solferino 2021, War, Civilians, and Humanitarians in the 21st Century, this new kind of warfare that we have been having over the last few years. And I recommend all of these to anyone who is in Tanya. Thanks. So before getting started, we're talking about the provision of humanitarian assistance to civilians who are affected by war and conflict. This assistance is delivered in accordance with humanitarian principles that have become very by those people who practice the delivery of humanitarian assistance. I'll make more remarks about some of them later on. The first is humanity, and that is that everyone in assistance has the right to receive that assistance. Neutrality, I'm going to let that go by now. It's sometimes misunderstood and confused, and I think there's been a lot of criticism over the past of the International Committee of the Red Cross, which is the guardian of these humanitarians, over their discussions that took place in Moscow with Putin and his colleagues. And the Red Cross has been severely criticized for that. I'll come back to it later. Assistance needs to be given in an impartial way. We don't deliver humanitarian assistance on the basis of creed, religious belief, race, ethnicity, or any other assistance, any other characteristic other than the fact that there are people who are in need. It may seem somewhat difficult to practice, especially in circumstances. Neutrality and impartiality are not the same thing. The delivery of assistance does not interfere with the ability to speak out when crimes are being witnessed or to advocate on behalf of one or the other side. And finally, humanitarian assistance needs to be delivered in an independent way and of the foreign policy of any of the combatants of the warring forces or even other forces as well. Next slide. Thank you. So here's a picture of Ukraine. These are the circles within the country are places where there are concentrations of internally displaced persons. You see the bordering nations, the numbers under their names represent the numbers of refugees that have been registered in those countries as of the end of March. Doing a webinar on a Wednesday, but the WHO releases its numbers on Thursdays, so we're a few days into this current and latest report. It's quite a lot of refugees, over 4 million have fled all over the country, including to Russia, sometimes taken to Russia by the Russian forces, and that there is incredible displacement both to the north and to the east. We can come back to us more of the specifics of this in a minute. Next slide, please. Tanya, could you, thanks. So quickly through this, the pre-war population of Ukraine was 44 million and have been directly affected by the war. That means that there is conflict in the places where they are living or had been affected by the war, and the consequences are quite grave for everyone. There are, as I mentioned, 4.2 million refugees and almost 6.5 million people displaced map. Next slide, please, Tanya. I want to start with this issue of the attacks that have occurred on health facilities, that is clinics and hospital personnel, doctors, nurses, and other people working in the health sector with this, because this is a very grievous issue and the consequences. There have been more than 77 attacks on facilities, including on that have affected more than 300 health facilities. I think the one that's received the most publicity is the bombing of the maternity ward in the Mariupol hospital, but there have been many other attacks on health facilities as well, which comes as a little way because Russia has been bragging quite a lot about the precision of their guided missiles and how they're able to hit very, very small targets, even as far as a continent away with their missiles. Yet they deny the fact that there have been these targeted attacks. I remind everyone that we saw the same kinds of tactics being used during the conflict and still happening in Syria as well. So we know that this is part strategy. You have the numbers here of attacks that have occurred on health personnel, on health transport, ambulances, and the like. And remarkably, 11 attacks that have impacted patients who were being treated in these facilities. Absolutely outrageous. In all, more than 70 people have been killed in these attacks on health facilities, and more than 40 others have been injured. Next slide, please, Tanya. In 2016, due to the advocacy of a large number of people, the United Nations Security Council, this was happening during the Syria conflict, wrote this: adopting Resolution 2286, which was co-sponsored by more than 80 member state council, strongly condemned attacks and threats against the wounded and sick, medical personnel and humanitarian personnel exclusively engaged in medical duties, as well as in hospitals and other medical facilities. It deplored the long-term consequences of such attacks for the civilian populations and healthcare systems of the countries concerned. We can see that what's been happening in Ukraine is in direct contradiction of this UN Security Council resolution, not for the first time, but it does explain why, in his remarks to the Security Council yesterday, the president of Ukraine implored the UN to act that they had already adopted. Next slide, please. Let me turn to the priority public health concerns. And when I'm speaking about this, I mean for the situation that has been affected by the war. First and foremost, of course, are conflict-related trauma and injuries. I won't go into any details regarding triage. As you can all imagine, the number of personnel available, the resources available in terms of supplies, all are seriously affected. It means that those people who might, under other circumstances, be able to receive treatment for their wounds now have to be prioritized, triaged, and taken in the order of their treatment. This is a terrible, terrible, terrible situation whenever it occurs, and one can only hope that the people who need help are getting it and that there are enough medical and surgical personnel available to provide it to them. I want to go next to maternal and newborn health. I mentioned the destruction of them in Mariupol. There are 80,000 women estimatedly who are currently in the third trimester of pregnancy in Ukraine. Many will seek to flee. Imagine what the outcomes of many of these pregnancies will be. There's been serious disruption of people's ability to access gynecological and obstetric services, antenatal care, postnatal care, or for anyone to deal with emergency obstetrical complications as they arise. Food security and nutrition is a huge issue overall in terms of the disruption of the food supply, not only for the Ukrainian population, but Ukraine and Russia both are major suppliers of wheat around the world. And this war is responsible for basic food commodities in many, many countries around the world, and will cause food security not only in the warring nations, and especially in Ukraine, but in many other countries as well. In Ukraine specifically, there are very low rates of breastfeeding and a high dependence on infant formula. The situation will be addressed. Remains to be seen, although of course many of the interveners are doing whatever they can. There is, of course, a threat of emergence and of spread of infectious diseases. I think the first phone call from the media that I received asked me what was going to happen to COVID. The reason I put in this parenthesis to put the principle of humanity first is because I'm very sensitive regarding the possibility of barring people from crossing international borders to countries to which they might be felt to be carrying infectious diseases like COVID. I think it's really important that we put our humanity first and realize that there are interventions that we can put in place to deal with refugees who are seeking protection and asylum and who are fleeing from war, and that we do not need to feel that refugees are carriers of disease. That's not the way we should be characterized. That said, one should mention or point out that there are low vaccination rates in Ukraine. Vaccination was at around 40% at the time the conflict occurred, but not increasing very rapidly. There is a notable drop of incidence in the country now, as there has been throughout Europe until quite recently. But we also have to remember that very little testing is being done. It's all been disrupted due to the conflict. So if there are any questions regarding the threat that the pandemic poses to the neighboring countries or within Ukraine itself, we can talk about that a little bit later. Was cholera in Ukraine in 2011. I don't think it can be considered to be endemic, and I don't know the circumstances of that relatively small outbreak, but there are now about 1.5 Ukraine whose access to safe water has been disrupted. So again, one has to keep this in mind and take appropriate preventive measures. There's also been vaccine-associated polio in Ukraine, and a nationwide polio vaccination campaign was underway at the time that the conflict occurred. It's very difficult to get any information now. Surveillance systems are not functioning. Of course, the acquisition of data in conflict is very, very complicated and difficult. And when it's available, it's hard to interpret. There have been reports of measles as well in some of the countries which are harboring refugees. Notably, there was in Romania, which was, of course, immediately attributed to refugees from Ukraine. Further investigation, it was found to be a small outbreak in Romanian children themselves. Next slide, please. Chronic diseases dominate the landscape in middle income, upper middle income countries like Ukraine, and they are in the minds of many the really major concerns with the conflict. People with chronic diseases, as many as 30,000 people infected with HIV, whose access to antiretroviral therapy has been disrupted. Tuberculosis has always been a problem accompanying HIV, but in and of itself as well, with the emergence of MDR TB, and many programs were underway, particularly in the eastern part of Ukraine. Prior to the conflict, my own organization, Doctors of the World, was receiving a large sum of money from USAID to run programs in the eastern Ukraine, and we were certainly not the only NGO that was present at the time that the outbreak of conflict occurred. We were dealing not only with infectious diseases, but also providing assistance to the elderly and other vulnerable populations. The other chronic diseases, diabetes, cancers, cardiovascular conditions, all are highly prevalent, and people do not have access to their medications. More than 50% of all the pharmacies are not functional. Many of these drugs come from Western pharmaceutical outlets. Their delivery has been stopped, both from the West to Ukraine and certainly within Ukraine as well. So this is a major problem. There are ways that are in which it's being addressed, at least for people who have been able to flee the country to the neighboring countries. WHO and the governments of those countries themselves and the European Union are setting up referral pathways so that people can get back on their meds, either in the countries of first asylum, which are the border countries, are referred, but many people who are reaching countries like Poland, like Moldova, like Slovakia, are being further sent along the line and being accommodated in health facilities in other countries of the EU. Next slide. So the final concerns that one would have are with mental health and environmental health. Dean Goldman has already mentioned them, and I would refer you back to her remarks. The Interagency Standing Committee is a body of UN agencies and NGOs and other partners, the Red Cross movement, that does and guidelines regarding a lot of health issues and issues in other sectors for humanitarian assistance. Their guidelines are being implemented, their mental health guidelines are being implemented for refugees in the border countries, and many points have been set up to which people crossing borders are being met with people who are skilled in the delivery of what's called, I'm blocking now, a mental health first aid, and being comforted, consoled, and being given guidance as to how they can deal with the incredible stresses which they are undergoing as they've been forced to flee their residencies, sometimes separated from their families, and seek refuge in a strange, have little familiarity. It's really hard to stress how long-term the mental health and consequences of conflict are. And Dean Goldman has really taken pains to point that out. It's absolutely true. Next slide. I just wanted to mention a few things before turning to the question and answer period. First of all, I mentioned that I wanted to say a word about neutrality. The National Committee of the Red Cross has come under fairly scathing criticism for meetings that it held with Putin and others in Moscow, as I mentioned. They've really gone not only to defend themselves, but to explain themselves. It's very important and you can only demonstrate neutrality if you're willing to talk to all of a war. I mentioned the Solferino is the founding of the actions taken in 1859 are the foundations of the International Committee of the Red Cross. And the Red Cross was founded in order to be able to have access to non-combatants on all sides of a conflict. Non-combatants meaning people wounded and injured in conflict or removed from conflict for other reasons. They become prisoners of war. People need to have access to prisoners of war. Families need to know that their loved ones are safe. And people need to engage in discussions to ensure their access to ex-combatants. The Geneva Conventions have been updated to include civilians and not only ex-combatants as the subjects of the Geneva Conventions. So neutrality is quite an important issue. And I just wanted to mention for those of you who have seen this criticism of willingness to engage in discussions with Russia, that it's very, very necessary and should be recognized as such. I want to say two last things that you understand that this is the way things are. As Dean Goldman suggested, there are never any good outcomes when public health is concerned. The goal of humanitarian assistance needs to be to achieve less bad outcomes. No one can make this go away. No one is going to come out of this better than they were before conflict began. It would have been better to avoid conflict altogether than to allow it. And then my last comment would be to quote Tata, former high refugees in the UN, who put that thought as well as it could be put by saying that there are no humanitarian solutions to humanitarian problems. Humanitarians are always to try to mitigate the damage that is done. But the end to this conflict and whatever relief can be afforded to those people and so affected by it can only come from the political sphere, from diplomatic negotiations, and from the best efforts of those who understand that the consequences of war on public health and on all of the other social sectors as well are going to be with us for a long time, and they are truly unacceptable in the eyes of many. I agree with Dean Goldman that each and every one of us by the current situation and will be affected by the current situation in one way or another. So with that, I want to end, and hopefully we have a reasonable amount of time left for discussion.
So Ron, we have a couple of questions, and I think the first one might be for you. And that is, do we think the United States is doing enough in terms of delivering humanitarian aid to Ukrainian citizens and other countries that are taking in refugees? Are we doing enough?
Well, I'd like to answer that by saying that no one is doing enough. Suffering that's being felt is unfathomable and unquantifiable. I do want to add, though, that I think it's very important for all of us to understand that it's not only people in Ukraine that are suffering. There are conflicts in other parts of the world as well. Do not let us forget about Syria. Do not let us forget about Central African Republic. Do not let us forget about the Lake Chad Basin in Africa. There are really many, many places that I think get a little bit forgotten because of the proximity of Ukraine. Must be said because of the likeness, the similarity of the people of Ukraine to those in the rest of Europe. There have been instances, as you know, Dean Goldman, there have been many instances, especially earlier on, where even refuge was being accorded to people from Ukraine because they look like us, is what some of the Europeans say. I've asked my students in my recently concluded class what we actually look like who is us? What is our tribe? Who should African Americans, for example, feel the same with Ukraine do with other people who they might consider to be more part of their so-called tribe? It's a really difficult and interesting question. Hugo Slim, who I mentioned before, who's a really smart and brilliant commentator, does feel that it's normal to provide more assistance to those people with whom you relate, with whom you have an affinity, because you can't provide enough to everyone. I don't know if it's fair to say that that's the case. Certainly, there have been instances reported of bias and discrimination in allowing people to seek refuge in Ukraine, and I think that we would all agree that that's not appropriate. The short answer, that was my long answer. The short answer to the question is no. I do not think that the US or anyone is doing enough to bring this conflict to as swift a conclusion as possible. And that's what we need to do, put an end to the suffering that's occurring.
So Ron, one thing that I think might be different about this conflict than others, I see it with my daughter who's 25, and that is the way that the people in Ukraine are so connected via social media platforms to the people in the United States. And I mean, my daughter, who does not particularly connect to the New York Times or some of the journals that you put in your slides, sees things on TikTok and on Instagram and the channels that she's interested in. She sees things directly from people who are victims of this conflict, and it has caused her to be very strongly moved. And I'm wondering if the availability of these platforms and the connectivity that people are starting to have around the world might change the way that we respond when these things are happening, fair or not, that there is not that kind of connectivity, for example, to people in Syria who by and large probably are on different platforms or perhaps write in a different alphabet and are not directly connecting with our young people in the same way.
Yeah, I absolutely agree, Lynn, but then one has to ask what the reasons are for that. And should that be a situation that is allowed to continue? It's a little bit out of sight, out of mind. It's a little bit of we're all equal, but some of us are more equal than others, Why isn't there the same degree of connectivity in the Middle East and in the lower income countries of Africa, South Asia, for example? These are all issues that we are seeing now need to be corrected, So one reaps what one sows to some extent. That's why I think it's really important that we try not to forget about those who are less visible to us.
Agree.
But I will add also that there is a certain geographical proximity. I mean, they're making collections in the small village where I live. there's a van that's being, come and bring us your tins of sardines and stuff like that. We're going to drive our minivan up to the border of Moldova. I mean, I don't condone that kind of assistance. It's not the right way to do it. But it's true that even with the price of gas being as high as it is, people are willing to hop in their van and drive sardines up to the border to help feed the people.
Well, this, of course,
So there is a note.
yeah.
Go ahead.
This is, of course, one of the issues in doing assistance, and that is many people with the impulse to help, but basically showing up without necessarily the right preparation or the right food or the right infrastructure to be able to actually help. One of the things that one of our questioners asked is, given how our healthcare workforce has been taxed, I would say burned out by COVID, many people have been leaving the healthcare workforce. Do we think that is impacting the response and the aid that we have available for people in Ukraine? And how do we think this is impacting refugees? I think you already mentioned, the possibility that refugees could find themselves excluded because of COVID or being treated in a non-humanitarian fashion. But what is your thought about that? I think worldwide that people in healthcare are under a lot of stress right now.
My thought is, what a mess. Yeah, I mean, here we are in the middle of a pandemic. Who knows? Maybe, I don't want to step out of my lane, but I don't know whether the timing of this is also linked to the notion, to the fact that there is a pandemic going on, and that from the point of view of military strategy or political strategy, it might be a good time to take advantage. I don't know any of that, but I will say that, of course, the pandemic has been running through all of the countries of Europe, and that, as we have seen so clearly in the US, the workforce is exhausted. So yes, I'm sure it's making a contribution to their inability, but perhaps I don't want to let the notion of, I don't want to heighten the importance of the pandemic at the expense of diminishing the incredibly and unfathomable damage that war brings on to civilian populations, no matter what
Hate to be
line of
given the
work they're
choice.
engaged in.
Yeah.
Exactly.
Hate to be given, but of course, yes, the permanent damage from war, it's very long term. The question, interesting question, what's the most pressing issue? Is TB, HIV? How do you figure out what's the most important thing to do? And I'm guessing your answer is going to be there is no one thing, but
my answer is, I don't know if there are listening, but they would answer this. I always start my courses with a discussion of what is called, and many of the students will be available, and many of the people online will be familiar with this, what's called in Philosophy 101, the trolley problem. And, this says that, one way to sort things through is to figure out what's going to cause the fewest number of deaths. It's not, you can approach it that way. You can say, well, if I don't have the data in front of me here, but I think the most important problem is the one that's going to cost the most lives. That's one way of saying it. But then you can start layering and parsing that out. And in the end, the answer to that question has to be in accordance with what your values are. People approach the issues differently. They approach it from their own hearts, from their own minds, and in accordance with their own. To answer the question, what is most important, it always comes down to what is most important to you. And it's really important when contemplating going into the delivery of humanitarian assistance to give very, very serious thought to who you are before you get put in a situation where you have to make a decision like that. So I can't really answer that question, not being there. Sometimes it's very contextual. You'd have to know a lot more about not just who you are, but I think it's critical as well to ask that question of the affected communities. They're the ones who have the answer. What is most, so I don't know. And under the fog of war, I think it's very that answer. Very difficult to do community-based surveys with any accuracy at this point in time, but that's what ought to be attempted.
So as you can hear, you're not the only one with a dog in the background, Ron. There's a question that I think maybe is not one that you and I can answer, but I'm going to mention it anyway. I mean, should the UN be performed? And I think what the questioner is getting at is the veto power that Russia has on the Security Council. I think that's a very, I mean, that gets at a very, over this, I'm not sure that that's even politically possible.
I don't know. I laughed a little bit when you asked that because I've been dealing all day long and yesterday with an own organization, which I have threatened to leave unless they remove the veto power from some of the larger chapters that we have. So that's a very relevant question to me at this time. I purposely put up that UN resolution. The UN doesn't seem to be as effective an organization as one that we need in addressing these kinds of issues. Even if Russia did not have veto power, let's suppose Russia had vetoed the passage of that resolution, and it did not, it signed on to it, when it was the one that was perpetrating these acts in Syria as well. But even if they had vetoed it, what would change? There is that resolution. The UN is not implementing it. The UN does not have the power that it needs to do these things. It's not made for, I think I can say this, it's not made for these kinds of issues. It's made for political negotiating and diplomacy by means up to but not including war. But when war breaks out, it doesn't seem to have the ability either to alter its course, to affect the manner in which it's conducted, or to bring it to a rapid conclusion.
I mean, I think that our NATO alliance is far more capable of moving quickly, but it's obviously does not represent the entire world by any stretch of the imagination. But that is, you know, the UN is not really a very nimble organization. I think in a lot of areas we were frustrated by that.
Yeah, but these are, you know, these are now we're offering lay opinions. Really, this isn't really
not the experts.
Our line of work.
Exactly. Now there is something that's more in our line of work, and that is, I mean, there are a couple of comments, and I might go back to one of them, but one of the participants points out that socioeconomic status and access to education might explain some of the reasons for more or less connectivity for people in different countries, and I think you were implying that in your response to the earlier question, Ron. But one of the participants brought forth a clarifying question, I think, about the earlier one, that they were really concerned about just the availability of medical responders to provide support, if they're to mobilize all the people who are needed, I think, to move into the region to provide health care.
Okay, so I can address that. So certainly in the surrounding countries that are receiving refugees, there are adequate medical resources, it seems. Many NGOs have mobilized to send personnel there, but those countries have reasonable health systems in and of themselves. I mean, they're reasonably strong, and thank goodness in the last few, I wouldn't even say months, but say a month or two, hospital beds have emptied and there's become more space and more time for personnel to offer services. But there are also a large number of emergency medical teams, which is a component that WHO, the World Health Organization, has created and mobilized. And I think that there are now 44 emergencies, is that possible, that have deployed to Ukraine. So even if health personnel, they're being supplemented in large number by mostly groups from Europe, but from other parts of the world as well, that are sanctioned by the World Health Organization to mobilize rapidly and enter a humanitarian emergency settings in order to provide these resources. Don't think they, they're constrained not so much by supplies and things that they bring with them, but where they can physically access the population, where there's shelling occurring, where there's fighting. People don't go into those zones. They're dangerous, you know. So it's a little bit of a mix. I think that that's again why it's so important to bring as rapid an end to the conflict as possible, so that some of these health services can resume, and so that the goods that are required in the form of food, water supply, adequate shelter, medicines, and so on and so forth can be resupplied to people who need renewed access and renewed services across the board. And although we're a school of public health and talk about health, I'm really happy that the word education crept into the discussion at one happening in these children's lives, children who are trying to grow up and had been growing up normally normally and developing normally and pursuing their education and pursuing their dreams for a satisfying life, gone, fully disrupted. And who knows how long to get many of those kids back on track in new circumstances, in new environment. I saw, I was brought to tears by a video of two young Ukrainian children being welcomed into a school. All the children lined up, applauded, took their hands, greeted them, took them. That doesn't mean it's not traumatizing. That's again, an example of where we try to make the outcomes less bad, but they're bad. They're bad in education. They're bad in health.
Thank you so much, Ron. We're at the end of our time, and thank you also for reminding us earlier that it's not just the children from Ukraine, but children from Syria who are being welcomed into other schools by other children in Lebanon, and children who are refugees from the Tigray conflict. And there are way too many conflicts across the world, and these are very, very bad for children. Thank you so much. And thank you again, Tania. Closing words for us.
Thank you all for attending. This is very timely and a very important webinar. And I thank you, Dr. Waldman, and thank you so much, Dean Goldman. And everyone, if you like to watch this again, we'll have it on our YouTube channel later on today. And I provided that information in the chat, and we can also email it to the attendees. Hopefully you all enjoyed. I definitely received a lot of information. This is very informative. Thank you.
Thank you. Goodbye, everybody.
Thank you,
Bye-bye.
everyone. Bye.